So, as Ivan said, I'm going to talk about the Australian experience of patient associations. I've entitled it A Road Less Travelled because I feel we still have a lot of space, I guess, for people to interact with organisations such as mine. I have nothing to declare in terms of a conflict of interest. So just to set the scene for you, Australia is obviously a developed country. We have 24 million people. We are ageing quite rapidly. You can see from the chart there that we're getting middle-age spread. Our middle-aged and older people are increasing at a rapid rate. In fact, if you're sort of over 85 in Australia, you are growing to about 5% from 2% at the current time in the next 40 years or so. The fastest growing segment is people are 100 plus. And out of that population, we have about 300,000 people with glaucoma, which affects 1 in 200 at age 40, rising to 1 in 8 at age 80. And so the more 85-year-olds we have, the much more glaucoma we have to deal with at that end stage. We do, however, have a first world health system, and we spend a lot of money on glaucoma services. But we still suffer the problem of having approximately 50% of people with glaucoma not being diagnosed. And we also have at the other end almost 50% of people who have stopped their medication after 1 year. So we have universal problems. So our association's mission is to eliminate glaucoma blindness, and typically we have aims such as increasing community awareness of glaucoma as a blinding eye disease, and we stress the importance of having proper checks for glaucoma detection, particularly in an early stage. And you can see some of the messaging material we might use in various events like World Glaucoma Week, where we're saying a simple eye check might actually help you out there, don't let glaucoma get in the way, and so forth. But I'm just asking whether really community awareness has been very effective. We don't really have a great handle on the numbers of people with glaucoma because the last survey in Australia was done 20 years ago, where we did find we had about a 50% detection rate. We do, thankfully, have a new survey underway, which is currently being conducted in several sites across Australia, and the federal government has funded that, which we're very appreciative of. It's not just a glaucoma survey, it's really an eye health survey, but glaucoma information within it. We do know that optometry consultations have been growing about a similar rate to population growth. So there's probably not a great deal of new consultations happening sort of over and above, if you like. And we know as an organisation we only see we talk to about 3% of people who are diagnosed with glaucoma, mostly referred by doctors, particularly ophthalmologists. So we have a great deal of room for improvement in terms of us as an association being able to help. And it's fair to say the patient stories we have really are a mix of good, bad and very ugly there in terms of people's detection journey. And so we'd actually like to have a lot more good stories of people being detected early and not having significant sight loss by the time they talk to us. But there are barriers, certainly in Australia, to making a real difference as an association. We have a very far-flung population. We sort of congregate around the coastal areas. We're quite heterogeneous in that respect, so we don't have identifiable populations that we might be interested in sort of congregating together. So it makes your message, the reach and the frequency of your message very expensive to happen, and also the effect of that message is quite diffuse. We have 600,000 not-for-profit associations in Australia. That is absolutely mind-boggling. And so we are competing in a very crowded market for funding and also how noisy we have in the market to create that message. Glaucoma really is not topical. There are actually, the breakthroughs are fairly infrequent, and so it's not newsworthy there. And indeed, awareness weeks are not news. You can have an awareness day or awareness week every day of the year in Australia. And we all know that funding for glaucoma is fairly scarce. Because the industry has moved to generics, there's no real strong sort of market leader, if you like, that wants to expand markets, and so the dollars by industry have reduced. People with glaucoma who really are our strongest supporters are typically in a pension phase, so they may have assets but they're really quite cash poor and find it difficult to support us. And governments are particularly hard to receive funding from. They're quite results driven, and also the paperwork required to actually receive funding makes it difficult to use the money to make a difference. Also, the community is very blasé or uninformed. What is this thing called glaucoma, as Maria said? And the message that all eye health organisations say of get tested is fairly common, but I contend it's fairly ineffective call to action because it doesn't actually push people in to get their eyes checked. We know that 40% of Australian adults have not had an eye test in the last 3 years or have never had one. And obviously health professionals, the sort of what our eyes is almost what's happening in general practice these days. People are not even trained on eyes anymore. They can do that as an elective. It's fair to say optometrists are moving from a technician to a clinician phase, and I think that's going to be beneficial. Ophthalmologists are referral-based, and pharmacists have been incentive-driven. There's lots of things they can do, so they sort it out in terms of what's good for their income. And that means that glaucoma doesn't really get much of a say. And you really treasure what you measure, and we found measurement in glaucoma, particularly in patient associations and community outcomes, very important, very hard to do. So if you think of a patient lifestyle, all the way from an origination area where you saying you need to create the reason for an eye check, through to someone being detected, diagnosed, what treatment they'll go on, and will they actually stay on their treatment. The areas depicted by the ticks and how dark the tick or background is really where associations work. So we have characteristically looked at getting people in to get eye checks. We've had some involvement in information about detection, and then we've had some kind of role in the adherence area. And obviously we're not really doing diagnosis or treatment, although there's a little tick there because we have some information about those aspects, what options, what disease and so forth you have. So we know from guidelines that general community screening is not cost effective. Even sort of opportunistic screening really doesn't produce the results for the cost you have. I've got a couple of other further conclusions. One is that, certainly in Australia, community glaucoma awareness, promoting to detect the 150,000 people we don't have that don't know they've got the disease, is not cost effective either. It's really hard to find them. And the other conclusion we make as a result of that is that we believe you should work with the most easily identifiable and highest risk audience you can find to maximise the return on the investment you make. So which audience? So you can stratify the community into those people who've got high IOPs, which have an extremely high risk, various age groupings, a family history, whether their ethnic background has an influence or not, through to, let's tie our coattails to the diabetic population, for example, or let's do something with people who smoke because we know there are risk factors associated with that. And you could even think about gender, although we know in open-angle glaucoma there's not really much difference. There is something in angle closure glaucoma that you might want to do. So which audience do you do? And what is the best combination of the highest risk and ease to identify? Well, I'm contending really that family history of glaucoma is something we really should get a lot more serious about. We know that the direct relative of a person with glaucoma is about 10 times more likely over their lifetime to have glaucoma compared to the general community. And also they are more easily identified and reached. They are, in fact, our lowest hanging fruit as a community. So how do you identify them? Well, let's start with people who are already diagnosed with glaucoma, because they're a defined population. They're known to the health system, and certainly their ophthalmologist and maybe optometrist, GP as well. They know who their relatives are. They're the ones that they've cohabitated with for all of their lifetime. In Australia, there's about an average of 4 direct relatives for every person diagnosed with glaucoma. And they mostly want to help their loved ones to stay sighted. So they can be the family ambassadors through which to influence the direct relatives for regular glaucoma checks, and they should be our highest priority. So talk to the people with glaucoma about their relatives' risk. So how do you sort of then access the relatives? Well, in fact, if you educate people with glaucoma about their own condition first, so they're nice and comfortable about it, they don't have that fear that was discussed earlier, then you can talk to them about their direct relatives' high risk and the need for those relatives to undergo regular glaucoma checks, and then enlist them to discuss this with their relatives and teach those people with glaucoma how to have those conversations. And if we do that, we'll have improved and earlier detection rates. And the corollary of that is less people going blind. So in terms of glaucoma associations, this is the process we use. So we actually educate eye health providers, mostly ophthalmologists, but certainly optometrists, and we make ourselves relevant to ophthalmologists. We want to reinforce our role, which is a support role to what's being said in the office. We want to ask ophthalmologists about glaucoma patient referrals to us as an association, and formalise that. You can see the graphic of our material there that we use. And then we provide materials to the ophthalmologist to make it happen. When we get a patient referral, we phone them, we educate them about their disease, provide emotional and other support. We do eye drop training so they'll actually maximise their therapy, and then we have that family discussion. And we provide things like a family tree that you can see at the bottom there with the patient's relatives written in so that can remind them. That's a fridge magnet that we'll send them, stick on the fridge so that they can remind they've got to talk to Bob and Beryl and Sally and so forth. And we also provide a card for each relative with the relative's name on the top so that that patient can go along and have that conversation knowing what they have to say. And then we do some follow-up. So for associations, we want to make glaucoma referrals and family discussions the main activity. And just a little bit on World Glaucoma Week. We believe that World Glaucoma Week needs to morph a little bit into a twofold opportunity. One is a fantastic opportunity for funding. We know that associations are always funding scarce, so we believe that if you host a big, which is big is Beat Invisible Glaucoma breakfast, and you can raise a gift for whatever association it is, and we'd like ophthalmologists to be doing those things too. And we can also have the carrier of World Glaucoma Week messaging where we have for eye health providers, hey, get in partnership with your patient association and encourage these patient referrals. Resource kits available usually from associations to work in the office, and that glaucoma runs in families have the conversation message. It's a great way of having a media campaign to promote everyone having big breakfast, whether it's in the family, work or community setting. And you can have those those conversations, as I said, to get the message across of regular checks being required. So I just thought I'd play the community ad we had for our World Glaucoma Week this year. Oh, sorry, I need some sound.
10 times more likely to go blind. But I can do something about it. Glaucoma is a potentially blinding eye disease that runs in families. Too often it's invisible because families don't talk about it. With regular eye checks, you can beat invisible glaucoma. Hold a big breakfast, raise funds and help beat invisible glaucoma. Register at thebigbreakfast.org.au.
So in conclusion, when Family Association Road is more travelled by eye health providers, by people with glaucoma and their families, we believe we'll improve the low detection rates that exist across all of our nations. Thank you very much.
Geoff, thank you very much indeed. Are there any questions or comments that anyone would like to make? Terry, could I ask you to use the microphone?
So, have you had any issues when you are asking your patients to inform their families about patients being reluctant to share the information that they have glaucoma with their direct families?
We haven't come across reluctance within families to know about glaucoma. We have had a small amount of reluctance from people wondering that if they're more elderly, their son might not take them seriously. So that's the reason why we have a physical resource, because it's actually a combination of the person plus the association making the comments. And it gives them a nice to-do list, if you like.
Stephen?
Stephen Best from Auckland, New Zealand. Geoff, great talk. When you talk about the funding and the space with all the different organisations chasing the same thing, I think we've got a missed opportunity in terms of synergy with some of the other organisations that work in the same space. For example, patients with macular degeneration are of the age group now that is older, and that group is also more likely to have glaucoma. And rather than having an organisation that's just focusing on macular degeneration and one just on glaucoma, we should actually be looking at eyes, not just specifically. And we could potentially, rather than fighting for dollars against the Macular Degeneration Association and patient groups, we could actually do something combined space and really talk about eyes. Because most patients, or a lot of families, when you talk to them, they don't understand the family histories, not maybe just glaucoma, but other diseases as well. Just a comment.
Yes, I guess my response is that in Australia, certainly we have Vision 2020 Australia, which is part of the World Health Initiative of the Right to Sight. And so member organisations are across the whole eye health scheme there to be able to do some of this work at a higher level. And one of the things we've been considering in our Prevention and Early Intervention Committee is what do we do with awareness, which we put on the back burner because of the National Health Survey and a few other things out of the framework for eye health that we're running with the federal government at the present time. It's certainly something that we need to come together better at.
But I think it's worth saying that the organisations do collaborate closely and interact with one another, both through the forum of Vision 2020 and also directly.
Oh yes, we actually swap a bit of information and a bit of research and things like that, which is good. We have some glaucoma-aware people within macular degeneration, which is quite nice as well.
Please, go ahead. Can you identify yourself, please?
Dr. Su from New Delhi in India. My question is, glaucoma tends to run in families. So what if a patient with glaucoma asks, can I have a family? Now, this is in two contexts. He's the first person to have a glaucoma, and then there's another person who asked the same question, and he has a glaucoma history of glaucoma in the family running 2 or 3 generations.
Just didn't quite get the...
Sorry,
there's
with the echo, we didn't quite get the question.
There's a glaucoma running in the family. So the first patient is the first person to have glaucoma in his side of the family. His question is, can I go about having a family? My children, what are their risks for developing a glaucoma? And there's another patient who has a glaucoma running across 2 generations. And he asks the same question, what should be our answer? Can he go about having a family?
Yes, well, obviously anyone with glaucoma has the potential that their family will end up having glaucoma, and it may even obviously skip generations. So the advice we give is really that everyone who, particularly as a direct relative, should be checked on a regular basis and have that initial baseline check, and then talk to their eye health provider about the interval that they need to be coming back. Jamie Craig's work from Adelaide that I read showed that about 50% of people have some kind of family relationship in terms of their glaucoma risk, if you like. So the vast majority will have some concerns, but it's not a bad thing to have your eyes checked on a regular basis anyway.
No, this is about the risk for the children to be born with glaucoma.
Yeah, I think most of our patients are older, so this may be a relevant question for those juvenile glaucomas or childhood glaucomas, and I think that's a valid question. Where maybe they want to see a genetic counselor or somebody else to advise them further. It may depend on whether there's consanguinity in the family. But for most of our adult patients, I think the question is already too late to ask. They've probably already had their children. Yeah, thank you. Yeah, thank you, Geoff.